Well, welcome back to your 5 News at noon. Now, as the pandemic began and continues, doctors are examining and then re-examining the impacts of COVID-19 on the heart. And Ruben, February is also National Heart Health Month.
I need to pay attention to this. 5 News reporter Tiffany Lee joins us now live in studio to break down what it takes to keep your heart in shape. Tiffany, I know the cardiologist you spoke with says it comes down to being proactive, right?
Yeah, that's right, Ruben. I learned that heart disease can, in most cases, actually be prevented because lifestyle plays a huge role. Heart disease, it remains the leading cause of death in the last 2 years despite COVID. The CDC says that in 2021 alone, almost 697,000 people, they died from heart disease. So whether you have a history of heart problems or not, cardiologists say that it's time to take care of your heart.
According to Dr. Nassau Ajay at Baptist Health, most heart disease is somewhat preventable, as lifestyle plays a huge role in your health, as you can help to modify your risk factors.
90% of them can be changed by just changing our lifestyle.
A few ways you can do this is by working out at least 30 minutes at least 5 days a week, even if it's just going on a walk. You can also have a healthier diet, make sure you get enough sleep, don't use tobacco products, and drinking enough water and having regular checkups can help as well. And in the last 2 years, cardiologists have seen even more of a need for healthier lifestyles.
We see a lot more people coming into the hospital with congestive heart failure. The reason is because they've had a lot of troubles which they have attributed to the COVID. Of course, part of the COVID syndrome is the heart also. And so we are seeing a lot of people who have come into the hospital with congestive heart failure. And of course, now we are seeing a lot more heart attacks.
In the last 2 years, Dr. J has seen many more heart failure cases as well as heart attacks because of COVID complications and lifestyle changes. To prevent more people from suffering from heart disease, Dr. J says don't ignore the warning signs.
If you begin to have shortness of the breath or something that you cannot explain, those are things that we want you to be worried about. And of course, the discomfort in the chest. And I mean discomfort. I'm not using the term pain, because it can be described in different forms in many people, and that is what we tend to ignore.
But it's important to note that signs of heart disease can be different in men and women.
Classically, men would come with that heaviness and tightness in the chest, and that may begin suddenly or may be coming on and off. That is what we know about men. But in women, there can be subtle changes, just not having the energy, just feeling tired all the time. Those can all be signs and symptoms of heart disease.
It's never too early or too late to get a checkup when it comes to heart health. It's especially encouraged if heart disease runs in your family.